No one knows. I cannot see.
You never checked if I can see.
And now, this eye will never see.
So, do you see what I see?
My name is Kourosh Sabri, pediatric ophthalmologist at the Hogarth Family and Pioneer Energy Ophthalmology Center and associate professor at McMaster University. Vision screening in children is a matter of great public health importance. We'd like to raise your awareness regarding some existing gaps within the delivery of eye care to children and some exciting new initiatives we have here at McMaster to try and address these gaps. Ideally, all children should have regular vision screening by a local optometrist through those early formative years of childhood. It is very important to do so because if certain vision problems are not picked up in time for a child, it can actually become too late to do anything about this, and then this child can grow up with one or, God forbid, two poorly seeing or even blind eyes. Can you tell us what treatment was involved at the time to try and salvage some vision in your blind eye?
They did attempt the patching, but by then it was too late. So I had prescription glasses. You feel so unsettled and so mortified to have people look at you and all of a sudden they're looking beside you to see, or beside themselves, wondering what exactly you are looking at, if you're looking at them or somebody beside them. You can't describe how embarrassed you feel.
So James, I'd like you to expand for us, please, about the observations you made of her before she had the surgery to fix the wandering of the blind eye. How was she? How did that affect her behavior, her mannerism, her psychology?
It made her very unconfident in herself. Like, she wouldn't want to take photos, and when she did, she kind of hid behind me. It was really devastating for her.
You avoid any kind of eye contact with people. You tend to look down or away from people because you don't want them to notice, because other children tend to tease.
Can you tell us a little bit about how the poor vision, the fact that you are partially sighted, how does this affect you in terms of going out with friends, socializing?
Yeah, like if my friend wants to go for a bike ride, just even on a street, I can't because I fell before off my bike because I didn't see something. I want to get my driver's license.
Right.
And the doctor already told me that it won't probably happen. So for my whole life, I'll have to get someone else to drive me around. The stairs are a really big issue. I've fallen down them a bunch of times because they're the same color as the hallway. And so after I kept falling a couple times, they had to put tape on every single stair just for me so I could see. And it still wouldn't work. So from now on, we have an elevator in my school that I have to take to each floor. I don't use any of my equipment anymore rather than my laptop, and I usually take it home to use it.
Even though you have these computer devices in the class to increase the size of the reading and writing material for you so you can see, you actually choose not to use them than to have your classmates tease you because you have to use these devices to see.
The classmates would just make fun of it and make fun of my eyesight and that, so after that I don't use them anymore because of people.
And so how long is it that you've actually not been using what you should because of the way you're being treated by classmates?
A year and a half.
A year and a half. And are the school teachers aware of this?
Yeah, a lot of teachers, they don't really care, which gets me mad. I had to fight with my teacher because it was small print and he said I could see it.
We were quite shocked when we found out that she was blind. There was no indications. A lot of times people would ask us, did she bump into things, or did she walk into things, or was she clumsy? And there was no indication whatsoever that she had any visual impairment.
The mentality is if you can't see anything wrong or you don't notice that anything's wrong, that there isn't anything wrong. And really, I was completely shocked.
Research has shown that adults with poor vision have a greater chance of developing mental health issues such as depression and also have a higher risk of mortality. They also do less well in terms of educational achievements and socioeconomic status.
You know, these students, if they are not reading by the end of grade 1, the likelihood of them graduating from high school diminishes significantly. And we also know that if students aren't reading, the increase in mental health and behavioral issues increases rapidly as well.
Our idea was to find those children, because we recognize, even myself who's not an expert in eye care, that being visually impaired as you go through your school life, and if you have other disadvantages as well, that's a real problem.
The most alarming statistic of all is that if you grow up with one blind eye, you're almost 3 times more likely to have an accident and lose your only good eye, therefore becoming blind in both eyes for the rest of your life. And just for a moment, imagine how that would be.
It terrifies me to think that anything can take that good eye out. And, you know, if that happens, then reality is he's stuck with, you know, a partially blind eye.
What happened if I never found out about it and then I lost my eye from like a car accident or from a stick in the forest or getting it poked out by somebody by accident? Well, it makes me kind of scared. Like for jobs, maybe I won't be able to do certain type of jobs that I want to do.
He even would have been essentially blind for his whole life. And then, you know, think of all of the opportunities. We think of all the opportunities that potentially could have taken away from him. Careers that he could potentially do in the future. You know, would he be able to drive a car? Would he be able to have a driver's license? And all of these things run through a parent's mind.
Let's see what's inside.
It became a question of if we don't regain the vision in the one eye, then we have to protect the other eye with potential safety glasses and things like that, because if she loses the other one, then she would be fully blind.
In most regions in Canada, there are no uniform vision screening programs for children, and less than 15% of children under the age of 6 in Canada have ever had an eye exam. And that really is a shocking statistic. It's very important to realize that when you're born, you don't actually see 20/20, and your brain needs to receive clear images from your eyes in order to actually learn to see 20/20. If your brain does not receive these clear images in the first few years of life, past a certain age, it is actually too late to teach your brain to see clearly. It is incredibly important to correct these eye problems early on, otherwise, past the age of 6 or 7, it actually becomes too late.
We explained to her about the brain connection between the eye and what we were trying to do in creating that strong connection.
I actually teach about how the eye can adapt fairly quickly, especially at a young age. So I did know that you know, people can adapt and the brain can adapt, especially when it's really sort of a brain or post-eye issue a lot of the times.
Once the brain has developed, and that happens around the age of 8 or 9 years old, the chances of you know, the child getting their eyesight back diminish quite substantially.
Vision screening in children is an absolute must. We must screen children for vision problems in order to pick up those key issues which, if you do not pick up in time, will cause a child to become blind for life in one or both eyes. We need to screen because these conditions are treatable in the majority of cases, and the treatment is often very cheap, a $1 patch and a pair of glasses which cost no more than a few $100s.
It is a child's fundamental right to be able to see, to be able to access education, to be able to read, to be able to write. And we know unless we provide the fundamentals for them in terms of health care, in terms of ensuring that they don't come to school hungry, we have to ensure that they can see. I can assure you the graduation rates will increase, because students will have that equal opportunity from the minute they walk into my school in terms of their basic needs.
The philosophy of our school board is to try to identify children as early as we possibly can, preferably in junior kindergarten or before junior kindergarten if possible, so that we can develop interventions. Because what we know about children with vision problems is they do tend to have a large number of learning problems in school if they don't receive the appropriate treatment.
He's much older than children that come in, you know, at 5, 6 years old, and you think, okay, no problem, we can get the patching done. It'll probably get better quicker. But at his age, you know, the chances of, you know, his vision coming back fully was not as positive as we were hoping.
It's fascinating that just such a simple device as an eye patch can, you know, have such a meaningful impact on children, and just, you know, really underscoring, you know, the importance of that short time window of treatment that you know, you're not necessarily aware of. So, you know, whether it's screening in schools or, you know, parental awareness to get your kids to the optometrist for screening is just incredibly important.
This is something that is so simple. To me, it's almost a no-brainer. This is a reversible condition. It's easily treatable. We always thought that the important things were taken care of in our province or in our country. But this is one that I think has somehow slipped through the cracks.
So I thought, okay, I'm turning 40, I'll get my eyes checked, I'll get her eyes checked at the same time. And I honestly didn't think anything was wrong with her eyes at all, because she never seemed to have any issues. So we went in, got the eye exam, and I was shocked.
I didn't know that I was blind in my one eye.
When we went into her first optometrist appointment, I honestly was hoping that she just wouldn't need to wear glasses. And then when I found out that she was blind, obviously it became no concern about glasses, and it became obviously concern more towards her vision long term.
He was 7, and we had taken him for a routine eye exam to an optometrist for really no reason other than to have his eyes checked. We weren't concerned about any issues. And she told us that he was essentially blind in his left eye. And at first we didn't believe it. We didn't understand it because he'd never complained of any problems before.
They did a screening at her school, and the optometrist came in, and that's when we noticed that maybe she might need glasses.
So in other words, you had no idea that beautiful Marley here, looking with two what appeared to be healthy eyes, was in fact legally blind in one of them.
Correct.
One student in one of our schools, who I think is in about grade 5 now, and he's had difficulty all the way along. And he's just been diagnosed with a very significant vision problem. We were having difficulty figuring out why the behavioral issues, because he didn't seem to have all the other factors that would lead to a behavioral problem. And it turns out to be the vision difficulty, which was causing him the great frustration.
In general, though, it's not something you can tell. It's just, he's a normal kid. He doesn't tell you that he can't see out of one eye. It looks like he's participating because he's used to using the one eye, so it's not something you can catch, but it's definitely worth screening, because down the road, I mean, it's very important to have both eyes.
For me, I think back to, you know, what did we do wrong? Like, how did we miss this? We're both educated people, and we had, you know, but we've never worn glasses, never had eye issues. So how did we not think about this? Because we think about hearing, we think about all the other health checks out there, but didn't ever think about eyesight as one of the things that check.
We were certainly surprised, and a lot of our teachers were quite surprised about children in their classes who they didn't know had a vision problem. Sometimes those children display behavioral issues in the classroom, and we focus so much on the behavior that we sometimes forget that there could be some sort of underlying medical or physical reason why that child might be having a behavioral difficulty in the classroom. You know, it just speaks to the necessity of a program like this.
When you've got young kids, the idea of taking them, say, to the dentist seems very obvious. You know very clearly the consequences of not getting your teeth cleaned. This is the type of problem that usually doesn't have symptoms, and yet you've got that, you know, relatively small window of time. It's not that, you know, when they're 10 you can suddenly throw glasses on and fix it. And for us, that was just a complete lack of awareness.
I was especially upset with myself being a physician that I didn't pick up on this.
How do you feel that there were children who were visually impaired and even blind sitting within the classrooms in your school with nobody actually knowing that these children can't see?
When I first heard that 16% of my students could not see without glasses, I was astounded. At first I felt that we had done some sort of disservice. And then I felt, what a shame, what an entire shame that these students are sitting in the classroom. They're not able to see what's in front of them. They're not able to see the blackboard. So I felt that we were not addressing the needs of the whole child in our school, and I really felt that we have failed them.
Had we just been aware, if we could just go back and, why didn't we? How come there was nothing there to help guide us?
Definitely, I feel like there should be more promotion of it, because it was my own sort of decision to go and get her eyes tested, but I know a lot of my friends don't.
Teachers are pretty good observers of children's behavior, and we rely on them to identify children who may be having some difficulties. But even those people who are quite skilled in analyzing child development and children's behavior, they didn't pick up on many of these children.
Do you feel in the school system that there's a lack of awareness about children? I mean, based on your own experience.
Yeah, it's like they don't get it.
Right.
That a lot of kids are blind and they'll do so little.
I've identified many people who have perhaps vision only in one eye now because they're amblyopic, they have a lazy eye. And then the parents are absolutely shocked and horrified to find that their child only has one eye, and perhaps the other eye is something that perhaps barely can see the large E on the eye chart.
I didn't really have an appreciation for the magnitude of how important your vision is until we started talking about what happens if your vision doesn't recover, then you've only got one good eye.
It all comes from awareness. To me, it should be a standard, there should be a checklist when somebody takes their child home from the hospital after they're born. Hey, at 6 months, check your teeth, check your eyes, check your ears, right? And here's why you need to do that.
Vision difficulties are often not apparent unless somebody has a crossed eye, for example, or a malformed eye. And if they're like me and can manage with one eye, we don't recognize that they don't have binocular vision. And that can be both detected and treated. So I think we really do need proper vision screening for all kids.
It's not in this day and age understandable how a relatively rich society can ignore the needs of so many students in the context of vision, which is really important for education.
This is the problem in our community. This is why we're doing this study, because the parents just aren't either willing, able, or just aware enough to bring the children to the doctor.
Even though there's the opportunity to access vision care through optometry from the community in general, only 14% of those who could access that do that at the right time, which is terrible. So these are kids at the age of 2 and 3 and 4 who should be being screened, and a very small number actually get there.
I kind of find it unacceptable. I mean, eyes are so important. We need to take care of those children, give them a chance to have what they need, to have the advantage of having two eyes. Yes. Good confidence in themselves.
The parents only bring their kids in when they perceive there's a problem. And the kids don't have the frame of reference to know when there is a problem. They often don't let the parents know that there is something wrong.
When we see that a child's struggling with reading, we say to parents, please, could you go and get their eyes checked? And in some communities, that's an easy thing to say, and parents go off and do that. In other communities, such as our community, which is a community that lives in poverty, there are so many barriers for parents in accessing vision tests.
In Ontario, we have the sense that parents have the opportunity, so maybe in the past we've been lax in saying, well, it's not a requirement. But when you have, even with an incentivized program, a poor uptake, under 15% even, we need to deliver the students with need, the children with need, to those eye care professionals.
Particularly in the last couple of months, we have a number of newcomers. The face of the community is changing rapidly, and absolutely being able to speak to them in numerous languages, and again, to help them maneuver the healthcare system, let alone the education system, is again a huge barrier, absolutely.
It just puts into perspective how this expectation is just totally unrealistic. There is currently no good, comprehensive vision screening by community non-eye care professionals for vision problems in children. As a result, we have many well-meaning, good-spirited people, such as volunteers and other people doing the vision screening, but there's been no assessment of their accuracy in how they perform these tests.
Sometimes if it's a person who's just interested for a period of time and they're just getting a little bit of training, that may not be as good as what you've been offering us, which is a very sustained program over time where the people are very well trained and they have the backup of people who are professionals in that particular area.
A few parents actually came to me and mentioned that some of their kids were participating in a program in their schools, and it was originated by one of the local glasses stores. And my concern is that it's a commercial endeavor. They're trying to generate glasses sales. They have no protocols, they have no quality control, and there's a bit of a conflict of interest when their primary goal is just to sell glasses.
So I think we need to have something to substitute for that that's well thought out and sustainable with people who are highly trained to do this kind of work. And then we're confident in the results that we're getting.
I don't know that we have any kind of standard for this sort of care, for this sort of screening program. So that we need to establish those numbers, the false positive and negative rates, and we need to look at a model where we can pick these people up and then direct them to cost-effective solutions.
I think it's particularly odious that we don't have a program, because if we're going to screen for something, we should screen for things that we can do something about. And clearly we can do a lot to either enhance the quality of vision in people who have vision impairment, or to help them adapt to the reality that they don't have.
And so what interested me in talking to some of the advocates in there is how do you begin to connect the bits of the system, all of which are very, very good of individually, but how do you make it coherent? How do you use resources as wisely as possible to link the system and pieces together?
Government funding models have really pushed for looking for better ways to deliver care in a more cost-effective way.
And bringing them evidence is key, because I think bringing them stories sadly are two a penny. But I think stories, though, backed by evidence is really powerful.
We are here launching the IMAX study at McMaster University, which we are very excited about. This will be a study, a project, a community-led initiative, a partnership between the Children's Hospital here at McMaster, local community optometrists, as well as the school boards in Hamilton, to conduct vision screening on children while collecting data looking at the feasibility of training non-eye care professionals as vision screeners. The IMAX study will be in 5 phases. Phase 1 will involve recruitment of undergraduate students from across various faculties and departments here at McMaster. In Phase 2, these undergraduate students will be trained at the Hogarth Family and Pioneer Energy Ophthalmology Center at McMaster in the skills necessary to perform the various vision screening tasks.
So the very important part is we're going to take some of the undergraduate students here at McMaster, some in the health sciences programs, and we're going to develop a protocol, and we're going to teach them how to do the screening, things like color vision, depth perception, acuity for sure.
It's easily set up as a course. There's a mechanism for them to do that now, but as you scale this up, it could become its own module or course. That's a relatively simple thing to do.
Certainly in the Bachelor of Health Sciences program, I think we have a number of avenues where we have some flexibility to define courses. We have special topics and special projects courses.
From our perspective, providing students an opportunity to work with you on this kind of initiative and working with the community is exactly what the university and the Faculty of Health Sciences should be doing.
In Phase 3, these newly trained vision screeners will visit the schools in Hamilton aboard the iVan and conduct vision tests on the children within the schools. In Phase 4, the iVan will return to the schools, this time with the study optometrists on board, and the optometrist will conduct a full ophthalmological examination on all the children who failed the vision screening in the previous phase.
Once the protocols have been set and the student screeners are prepared, they will go on the iVan to the schools, and we will pull the children out of the class and we'll bring them to the equipment that we need on the iVan. We will determine if they need some further care, such as possible surgical correction, in which case they'll be referred back to the Children's Eye Clinic here at McMaster.
In phase 5, any children who require further follow-up in terms of eye care will either be followed up by the optometrist in the optometrist offices, or if they require tertiary eye care, they'll be referred here to the Hogarth Family and Pioneer Energy Ophthalmology Center at McMaster Children's Hospital, where a pediatric ophthalmologist will follow them up. Do you foresee an opportunity for us here at McMaster to then encourage other universities in Canada and abroad to look at developing a similar model of training their undergraduate students to go out in the community and serve in the way of providing vision screening for the children in their schools?
If you look at the landscape for Canadian universities now, the landscape is one in which presidents are talking openly about the need for universities to be more community engaged.
It dovetails very nicely with, I think, some of the priorities, not only in the Bachelor of Health Sciences program, but with the university community more generally around community engagement.
I think this will take over and become a model for other things that could be community-based.
This is something that we could institute easily. It's relatively low cost, and to me, I just don't understand why it's not being done.
I think showing that you can deliver appropriate care to those in need at a good dollar value, so you get good outcomes, good experience for those involved at the lowest price, which is really what you want to try and do in healthcare to ensure we spread it out effectively.
It brings together a lot of threads around, service to the community, enhancing health of the community, along with providing great opportunities for students to be involved in that. And I think there's a very fruitful future for the project.
It doesn't take away from the professionals involved, just finds cases for the professionals to care for. So this is sort of not a way of deprofessionalizing it, it's a way of case finding in a relatively cost-effective way to enable professional care to be delivered effectively and promptly.
The vast majority of our schools are involved in this, and they're quite happy to be involved with this because it's a very easy process for us to engage in.
Our responsibility is to work together to ensure that our children, every child, no matter what your economic background, has equal opportunity to access education. And that really is the solution to, I think, every issue.
We thought, how can just eye patching actually regain her vision? And we were quite impressed with our results.
We gave it a go, and I put my faith in you and the system and how it works, and it was pretty successful right away even.
I was a bit skeptical that it would actually work. It seemed too easy, to some extent.
And we were really lucky because the school was very accommodating and his friends were really helpful. So he wasn't being teased about it. Nothing like that happened.
They were very supportive of her wearing the patch throughout the day. They would take it off after the 6 hours for me, make sure that she was wearing it long enough. On picture day, they took it off for her so she'd get her pictures done and put it back on again.
He just went about his day as if he didn't have a patch on. It wasn't. Sometimes he would come home and start playing and he would forget his patch was on. And then, I would come home from work at 6 o'clock or 6:30 and his patch would still be on it. And I would tell him, Kevin, your patch is still on. He said, oh yeah, I forgot.
The exciting piece of this is we're a fairly dense population down here. How do you do this in Northern Ontario and much more geographically disparate areas? I think this is what the value is.
Hopefully we can continue on for many years, and it just becomes part of what we do in school.
It's easy to see that you're making a difference in the community and with students in the context of a very important issue. It's hard to ignore it as the solution.
Through this really unique prospective community-led research project, we will collect very robust data on the feasibility and accuracy of training non-eye care professionals as vision screeners. And really this McMaster model, I believe, will then help lead the way towards providing a sustainable and affordable means of vision screening for children in the rural and more remote areas of a country like Canada, in the more rural areas of other developed nations, as well as in developing nations. We are all here very excited about this project, as I sincerely believe that investing in children's vision is investing in their future, and we absolutely owe it to them to open their eyes. Thank you.